Hi there, my name's Ayden, and I'm a public health nurse specializing in school health at Southwestern Public Health. Today, we'll be talking about your child's growth and development and their transition to kindergarten. I'm pleased to introduce Dr. Erin Maruscak, an optometrist who is going to share her top eye health tips for preschoolers. Welcome, Dr. Maruscak.
Thank you.
To start off, can you tell us about when to start eye exams and why they are so important for children who are entering kindergarten?
Of course, that's a great question. Children should start having their first eye exam at 6 months of age. And then we like to see them yearly, starting around age 2 to 3. However, only 1 out of 6 Canadian children entering school have actually had an eye exam through their optometrist. And that's a big problem. We know 80% of learning in the classroom is visual. So, that might mean that your child's entering school having vision problems that could affect their ability to copy off the board, to read, even play sports. Speech difficulties and language delays, and also short attention spans have also been found to be more common in children with undetected eye problems. We really want families and parents to know that eye exams are covered in Ontario. They are free to them under OHIP, and that's up until the ages of 19. I think a lot of parents may feel that their child's going to tell them they might have an eye exam, an eye problem, but that's not always the case. Kids have nothing to compare it to. So even if your child's not having any eye problems, we encourage you to book an eye exam through an optometrist. It's really important.
If a child needs eyeglasses, can you walk us through some of the options folks have to get those glasses for their child?
Yes, of course. If your child does need eyeglasses, choosing a good quality frame and lenses is important. I like to ask their favorite color for frame because they're more likely to want to wear them if they like them. Um, you know, Kids can be hard on glasses, so choosing a good quality frame. Plastic lenses are used that have good impact resistance and UV protection. There's also transition lenses that darken when you go outside, and blue blocking filters that we can use on frames and lenses. We want parents to know there's a great program available through the Ontario Association of Optometrists. It's called the ICI Learn program. It's available to any child enrolled in a junior or senior kindergarten class. And what it gives them is a free complimentary pair of eyeglasses. You do have to have the eye exam through our participating optometrist, and that can be found on the website www.icilearn.ca. There are other programs through ODSP, Ontario Works, and IHB that may help cover the cost of eyeglasses. And parents should also check with their private insurance because they might have some coverage through that as well.
So next, we'll talk about injuries. What are some of the most common injuries that you can share a few quick tips on regarding eyes and eye health?
Yeah, some of the more common injuries that we see in our practice are from falls, sports injuries, especially from baseball, basketball, racket sports, hockey sticks, scratches from pets, fingernails, sharp objects, getting sand in their eyes at the beach. And not as often, but some chemical or household cleaner burns to the eyes. Some eye injuries can be prevented by using eye protection, whether it be sunglasses at the beach, eye goggles for swimming, swim goggles can be really good in pools. So, those are just a few of the tips that I can give.
Do you have any other eye health suggestions for parents who are getting a child ready for school?
Yes, of course. So the first one that comes to mind is UV protection. Be sure to send your child to school with a sun hat and sunglasses. Add that to your back to school supply list. We like to choose a sunglass frame that has close fitting wrap to it and also has UVA and UVB blocking lenses. We know that children spend far more time outdoors than adults. 80% of their lifetime exposure to sunlight is by the age of 18. So we really want to develop, good habits wearing sunglasses outside to protect their developing eyes.
I'm sure some of our parents might have questions about blue light protection from screens that their kindergartners are interacting with. Do you have any tips for those parents?
Yeah. Yeah, children are spending a lot of time on screens with all the online learning, all the learning tools, computer games, TV. But we do recommend that children age 3 to 4 spend no more than 1 hour per day on a screen. So we recommend families create a media plan and just be mindful of those screen time limits. Some tips for your kids being on a screen is encourage them to take breaks. It's really important that they get outside. We also recommend the 20-20-20 rule, where every 20 minutes they look 20 feet away for 20 seconds just to give their eyes a rest. Encourage them to blink. We know that screens can cause dry eyes. Use proper lighting in the room. Sit arm's length away. And also, there are blue blocking lenses that are available for screens. We recommend your child avoid being on a screen right before bed as it can affect their sleep. And lastly, just developing healthy habits at a young age. Healthy body means healthy eyes. So, getting the proper rest, exercise, and nutrition is also important to keep your little one's eyes healthy.
Excellent. Thank you so much. So I want to thank you for answering all my questions today, Dr. Mariuszczuk. This interview has been very insightful on kindergartner eye health. If you have any concerns about your child's growth and development, please contact your healthcare provider or speak with a local public health nurse. Again, thank you so much, Dr. Erin.
Thank you.